at 32 other residency programs across the country. And we're all here for the same purpose. The purpose of this gathering today is to publicly voice our support for access to health care for children, for our patients in our city, in our state, in our country. I'm sure you've all had the opportunity of encountering patients who are uninsured and encountering children who are uninsured. And the sad thing is that going beyond that, there are actually a pool of children who currently are insured and are at risk of losing their insurance. And so we just wanted to stand up here today and just say, as pediatricians, as family practitioners, as nurses, as doctors, that children deserve access to health care. And we feel very strongly about that. We want to let that be known. She's a researcher in pediatrics and in health policy, and is one of our supervising physicians here at San Francisco General Hospital.
Hello, and welcome to everyone who has joined us today. Our fellow family and community medicine doctors helping us to take care of the kids. Also our community partners such as the Children's Defense Fund here in San Francisco, as well as nurses, social workers, and other people. Vulnerable population and our most valuable asset. As a country, we owe them access to health care. All of us here today are here in order to speak out for health care access for children, and particularly for SCHIP, which is a program that covers the basic health needs for children of the working poor. In California, this program is known as Healthy Families and is familiar to every practitioner here and across the state. We're here not only to speak for the 6.6 million children in America who rely on this basic coverage, and not only for the 800,000 children covered in California, but for the individual kids we see every single day in our clinics. If the kids I see today lose SCHIP tomorrow or next week, I will not be able to prescribe them their basic asthma medications, and I will be seeing them only in the emergency department for asthma emergencies and never for well child care, where I can actually make sure their asthma is under control. I will not be able to address daily issues of nutrition and help prevent the long-term detrimental consequences of obesity, and I will not be able to provide basic vaccinations to any of them to keep them healthy. Children are not only wonderful little human beings, hilarious and cute, who are the reason we all come to work every day, but they are also our future, and we owe it to them to provide basic and decent health care, particularly the children of the working poor. Children who are uninsured are more likely to miss days of school and 6 times more likely to go without needed medical care. If, as a country, we have promised to leave no child left behind in education, then no child should be left without access to health care. Children are our most vulnerable population and our most valuable asset. Keeping the source of our country's greatest potential healthy is something every senator and representative can understand and support regardless of political party. The bill for reauthorizing SCHIP already has broad bipartisan support, needing only 25 votes in the House to override a presidential veto. We are joining the voices of 32 other pediatric programs across the country and in 20 different states. And we are here today to call out every political leader who has a voice to stand up with us to support children's health care.
I just want to thank everybody again for coming out. It's incredible to see the support, and you're all taking time out of your regular jobs to do this, and that's just very impressive. I just want to say briefly that of all the issues I worked on my day as a children's advocate, SCHIP reauthorization and expansion should be a no-brainer. It has bipartisan support in polling. Democrats and Republican voters both like it. All the governors like it. It's not a difficult concept. Children are very inexpensive to treat if they're insured and if things are caught early. Yet, our president is threatening to veto this bill because of supposed fiscal conservatism. I say, is it fiscally conservative to have a child arrive at the emergency room gasping for breath when they could have had prophylactic asthma medication? Does that make any sense? Does it make any sense not to have children have basic dental and vision coverage so they're sitting in school and their teeth hurt and they can't learn and they don't have glasses and they can't see the blackboard? Does that make any fiscal sense? So I'm so glad to see all of you out here. I'm hoping you can call on all your friends and relatives and everyone to send a very clear message to President Bush. Don't veto this bill. Thank you very much.
Of healthcare access for all children and the importance of the SCHIP legislation. I want to leave you guys with some tools, some things. Well, what can I do? I feel strongly about this. We know that our representative from our district is supportive and is very publicly supportive. And really what we need to target, people we need to target are the congressional representatives from districts who are against this and could potentially be swayed. And the fact is that you do have some way to intervene there because you may have friends or family in these districts. You may even be still voting in this district if you moved here recently. So what we have up here is actually a list of some of the representatives in the different states that have voted no. Some of them are right here in California, mostly Southern California, but still. And we'd like to, if you're interested, if you could approach us afterwards and we can give you these lists. They have the phone numbers of their Capitol Hill offices, and you can have people call. And just think about it. If you start an email chain with these senators, representatives, to target them, think of who that could reach, and somebody, one of their constituents, who will make a difference. Thank you so much, and we really appreciate your effort on behalf of the kids.